I'm going to start our presentation with the anatomy structure of respiratory system. The respiratory tract is divided into two sections at the level of the vocal cords, which are the upper respiratory tract and the lower respiratory tract. The upper respiratory tract consists of nasal cavity, paranasal sinuses, pharynx, and superior portion of the larynx. The nearest and anterior portion of the nasal cavity contains sebaceous glands and hair follicles that serve to prevent large harmful particles from entering the nasal cavity. Paranasal sinuses are air-filled spaces of several bones that form the walls of the nasal cavity. Paranasal sinuses receive the inhaled air and contribute to air humidifying and warming. They also help in trapping harmful particles, dust, or bacteria. Pharynx contains three parts, which are nasopharynx, the first and most superior part of the pharynx, found posterior to the nasal cavity, oropharynx, posterior to the oral cavity, and hypopharynx, which is the most inferior part of the pharynx. The superior portion of the larynx conducts the air and houses the vocal cords that participate in voice production. Most of the upper respiratory tract is lined with the pseudostratified ciliated columnar epithelium, except some parts of the pharynx and larynx. The functions of the upper respiratory tract are conduction, filtration, humidification, and warming of inhaled air. The lower respiratory tract consists of inferior part of the larynx, tracheal bronchial tree, and the lungs. The tracheal bronchial tree consists of the trachea and intrapulmonary airways, which are bronchi and bronchioles. The right lung is larger than the left lung and consists of three lobes, superior, middle, and inferior, which are divided by oblique and horizontal fissures, while the left lung has only two lobes, superior and inferior, which are divided by oblique fissures.
Pulmonary ventilation can be defined as the process of air flowing into and out of the respiratory system due to the pressure difference between the atmosphere and the gases inside the lung. There are two ways of air movement entering and exiting our respiratory system, which are inspiration and expiration, or we used to familiarize with the term of inhalation and exhalation. During exhalation, diaphragm will contract and move downwards, which will increase the space in our chest cavity, thus the lung will expand. The muscle between our ribs also help to enlarge the chest cavity. They will contract to pull our rib cage both upwards and outwards when we inhale. In contrast to the exhalation process, diaphragm and rib muscle during inhalation will relax, which reduce the space in the chest cavity. As the chest cavity gets smaller, our lung will deflate, similar to how air releases from a balloon. At the same time, carbon dioxide-rich air flows out of our lungs through the windpipe and then go out through our nose and mouth. In this part, I will be explaining about the lung volume and capacity rate. The expansion and contraction of the thoracic cavity, which houses the lung, causes the changes in lung volume during pulmonary ventilation. As we can see here, in this diagram, it shows the waveform produced by spirogram that represents the vital capacity. There are four types of lung volumes, which is the tidal volume, that is the small air that we breathe daily, and then we have the inspiratory reserve volume, IRV, which is the air that we forcefully inhale, and in contrast to IRV, we have the expiratory reserve volume, ERV, which is the air that we forcefully exhale, and lastly, we have residual volume, RV, which is the air or gases that we cannot forcefully exhale. Based on this diagram, we can further simplify it into this table that shows how a normal lung capacity works. We start off with the tidal volume, which consists of 0.5 liter of air, and above it we have the IRV, which is 2.6 liter, and below the tidal volume we have the ERV, 0.9 liter, and the bottom part we have the residual volume, which consists of 1.2 liter of air. The summation of IRV, TV, and ERV will give us the vital capacity, which is the air that we require in life, and the summation of IRV and TV will give us the inspiratory capacity, and the total of ERV and RV will give us the functional residual volume, FRV. The total lung capacity is equal to the summation of IRV, TV, ERV, and RV.
The last part, I will talk about homeostasis. Normal homeostasis and factors that disturb our normal homeostasis. The respiratory system helps to maintain homeostasis by controlling the balance of oxygen and carbon dioxide in the blood, regulating the pH of the blood, and regulate body temperature. Pulmonary ventilation is controlled by sympathetic and parasympathetic region of the autonomic nervous system. The first one is temperature regulation. Exhalation facilities in dissipating excess heat in human body. Air that enters the lung is warmed by body heat and then exhaled. This coupled with the evaporation of sweat from sweat glands called the body. And the second one is pH regulation or acid-base balance in the body. The breathing rate increased to reduce the amount of carbon dioxide in the blood. So the pH of the blood increased towards normal level when its pH becomes too acidic. Alkaline blood with high pH triggers slowing of the breathing to increase the amount of carbon dioxide and thus carbonic acid in the blood to lower pH.